Thank you. So I want to speak about the work that we've been doing as part of the Prevention Centre and the food project that we've been running out of RegNet. Really, I should really thank my colleague, Dr. Mel Pesgood, who's really been leading a lot of the work from RegNet. And what we're trying to do is kind of shift the way of thinking about the drivers and the policy responses to healthy eating and the inequities in healthy eating. Because often the way we do tackle that is we think about the factors within the food system. So yes, it's very important that we think about the food that's produced, the way it's processed, the way it's the retail environment. We think about the fast food outlets, and then of course what comes onto the plate and the different social and cultural practices around cooking and eating. And all of that's very important, and if we got policy that moved up that food system, I would be very, very happy. But we would also want to think about, especially when you start to think about inequities in healthy eating, we really have to think about the social system as well, you know, being able to have enough money to eat in a healthy way, being able to access the retail environments, so whether that's around affordable, accessible public transport, for example. So thinking about that wider social system in which people make their dietary choices. And then, of course, thinking about the environmental system, there's this bi-directional relationship between the natural environment and the pressures that it puts onto the food system, you know, in terms of the sort of environmental degradation that we're currently experiencing and how that's affecting the sorts of foods that are produced, the prices of foods. People will remember what happened to the prices of bananas in Australia, for example, a number of years ago. But of course, that the food system is also one of the biggest contributors to environmental destruction, and we can think about the sorts of policies in a way that is both good for health, nutrition and health, and is also good for the environment. So there's real possibilities, I think, for thinking about coherence across all of these systems, and that's certainly what within TAPS that we're very interested in seeing, how coherence can take place in the system in order, in this project's instance, in order to produce better nutrition, better diet-related health, and in a more equitable way. So what we've not done is eat what do poor people eat. What we've started to ask in the HE2 project is, what is it about the food system and the local environment that encourages or doesn't, but encourages bad diets? And then also thinking about the wider social determinants of inequities in healthy eating, so issues around, as I say, around those social systems and social policy questions as well. So what were we trying to do within this particular project within TAPS? I've listed them there, and really trying to think about, really in the way that Andrew was saying, in terms of, I think I've always been working in a systems way, but I've never called it that or never quite had that framework in my head. But so we've been trying to make that quite explicit as understanding how all of these different drivers interconnect together, connect in messy, messy, messy ways. Using that sort of approach, thinking about and assessing policies for their ability to produce health equity, and then the big question of what are the barriers and therefore opportunities to get this broad approach across governments and intersectoral action to pursue fairer and more nutritious diets. So in our first project, this is about building up this causal loop diagram, and I'll show you this incredibly messy thing in a second. This is a sanitized version of it, the building blocks towards it. And this was work that was led by a colleague, Ellie Malbon, who's a systems modeler. She's not a health or a nutrition person at all. She's a systems modeler, helping us to build up using a collaborative group building process to construct that. Now, again, I really don't expect you to be able to read that, but what that's demonstrating is the social policy issues, the education policy issues, the transport policy issues, the food system policy issues, and how they're all interconnected together. So if you do something in the food system, you can see how it's connected through to what happens in terms of a social policy issue and vice versa. And how by finding, and we've not got to this stage yet, but by finding the key leverage points in that system, the very effective leverage points, we can produce better and more equitable nutrition. The second part is around the HE2. So HE2 is the healthy and equitable eating framework. And we'd like to think that what we're doing is, many of you who would work in nutrition or in public health nutrition would be familiar with the nourishing framework that came out from the World Cancer Research Fund. So really this incredible compilation of policies and programs from all over the world across a number of different policy domains within the food system. And then building on that, the work that's been happening through the Informus network led by Boyd Swinburne, again thinking about monitoring the different policies that are happening at different levels within the food system and the food environment. So we are being completely arrogant, thinking that we're going to be just like these two big global frameworks and start to think about an equivalent, but one that brings in these other policy domains, and we're starting to build that up. What are the the high-level actions that we think can and that are being taken internationally, but particularly in Australia at the moment, and then starting to populate that framework with those policies that exist around Australia and then around the world, hopefully. And then the third is working with colleagues, and we've been working very closely with Paul, and you'll obviously hear much more about what's happening in the ACT, and then with colleagues in New South Wales Health, to try and understand just what some of the difficulties are, and really the opportunities for moving these sorts of agendas forward, moving that paradigm of addressing healthy eating. How can you do that within a government context and then within that broader intersectoral context? And so using qualitative research, using key informant interviews with the various players across the different government departments within the ACT Healthy Weight Initiative that I know Paul's going to tell you about now, and then similarly with colleagues in New South Wales Health, where there's the HEAL strategy, trying to understand how some of those different players within education, for example, are able to take forward an agenda to do with healthy eating. We're in the process of doing all of that analysis. I don't have any actual data to share with you on that at the moment, but that's really illuminating how, if you think about that big sort of messy system, and we're saying look at the potential for policy coherence if we think in this way, what are some of just the practical challenges to making that happen when it comes to intergovernment working and then government and NGOs and others working together? So that's just to acknowledge this is a huge, big team, as is TAPS. It's gigantic, it's fantastic, and really about the different worlds, I suppose, just to acknowledge the different worlds that are coming together in trying to do the sorts of research that I've been speaking about, and you'll hear more about, of coming at it from an academic mindset, coming at it from a policy mindset, coming at it from a practitioner mindset. That's actually been, I think, one of the most important things that we've been doing within TAPS, is bringing these different views and worldviews to how you think about, in this instance, inequities in healthy eating. So thanks.